So this case study is on chatting doctors or Chatty Doctors. It's in our book on page 341. This case study involves a patient who goes into a physician's office, I'm assuming for her annual visit, wanting to discuss how she's doing and has progressed throughout the year. When she arrives in the office, the doctor greets her, asks her how she's doing, and she proceeds to let him know that she's been feeling great. She's changed some things in her daily habits and lifestyle, that she's been eating better, and wanting to state that she's been exercising more. However, the doctor tends to interrupt her and talk about his experience at a wonderful restaurant that he took his wife to, and so forth. He continues to talk about himself and his experiences on, great food and, what he's done and so forth. And, through the duration of this office visit, the patient is not getting to state how she's feeling, what her concerns are, things that she's done to, assist with her health and so forth. Pretty much the doctor then states, I've looked through your chart, it looks unremarkable, we'll see you next year, and proceeds to leave the room. So obviously the patient is rather taken aback. She speaks to a friend of hers and says, I went to my doctor today and I tried to explain to him what was going on, what I was doing, and he basically had no time for me and left the room. And her friend says, well, I wish my doctor was more like that, because I feel like I'm, nothing but a study of symptoms and test results. She says, I would be happy if my doctor treated me that way. And of course the patient who had the experience with the doctor said, well, I wish there was a happy medium. So, it does speak volumes when you have a relationship with a physician. And as a nurse, I tend to tell my patients, when they are discussing about their physician or their specialist or whoever they're seeing for whatever their, medical conditions are, if you do not like your physician, and there are people who, struggle with that, but feel they can't change because this doctor's been in the family for a long time, or they've been going to this physician for a long time, or so forth. And my response is, every time, if you are not happy with your doctor, you must find another one. Because if you don't, you are not going to comply with what is necessary to take care of yourself for your health needs. The medications that may be prescribed to you by that physician, you won't comply, and patients don't. I've been a nurse for a long time, and I see it every day. Patients who are not happy with their doctors, they think, the doctor doesn't know what he's talking about, he doesn't listen to me anyway, I don't need to be on this medication, and it's unfortunate, because there are very good doctors, out there who take the time to listen to their patients, who care about their well-being of the patient, and want them to succeed in whatever the case may be. If they have high blood pressure and it's being monitored by diet and exercise, they may have to be on medication for that. So their blood pressure medications, they want their patient to do well. That being said, it's also important that you have a good non-medical relationship, a mutual respected relationship with your physician and physician to patient. So yes, it's a good, healthy relationship to, say, hey doc, my life's been great. My husband and I did such and such. We've been traveling more. Or for the physician to say, yeah, I took my wife to this restaurant. It was really great. You should try it. You need to have that. It builds a trusting relationship between the patient and the physician, patient and nurse as well. Healthcare is a very high stressful environment. There are lots of things that, can be not so pleasant. Taking care of a patient who finds out they've got a diagnosis of cancer or something. Those are stressful situations, and it's very important for the doctor to understand that it's not the time to talk about the restaurant or the game of golf that they've played. It's about the patient right now. And that's part of our, ethical responsibility as well, is to make sure that our patients are safe, keep what has been diagnosed and the relationship and the information that we have about these patients, because they are intimate relationships. I mean, we know a lot about patients that they probably wish we didn't know, but unfortunately at times really need to know that so we can take care of them to the best of our ability. So it is helpful that, in those times the doctor can step aside from his personal, needs, or, wanting to have this, non-medical conversation with this physician, with this patient, especially in those times, because the physicians need to focus on the patient and what is best for them and what we can do to help them through, these diagnoses, these, treatments that are going to be necessary to help cure, or at least able to treat diagnoses, at least so the patient has the best quality of life. So, yes, we want our patients to be happy. That's part of the utilitarian focus. Yes, everyone, we want to be happy. We want to do whatever we can. But again, there are a lot of times when that's not going to happen. I'm an ER nurse, and most of the time my patients are not happy when they walk into the ER. They are frustrated at the wait time. They want to be seen immediately. They feel like they're dying. It's a now, me, focus on me, and that's it, no one else. It doesn't matter in the next room somebody is dying. We need to attend to them. So, there are times our patients will not be happy, but it's our responsibility as nurses, as physicians, to do the best that we can to maintain, a professional atmosphere and manners and behaviors toward our patients at all times, to keep them safe, keep what we know about them, what we find out about them, confidential. That's part of our HIPAA responsibilities, and the patient's privacy rights is that encompasses everything that goes with an ethical behavior, a professional, ethical disposition of really any professional, but specifically in healthcare, because it is so important, and it speaks volumes to our patients that we maintain that professionalism, that ethical standard, that our patients come first, that we care about them, that we keep them safe, that we keep our information, their information confidential, and that we do that in the kindest, compassionate way, and to build relationships so that they know that they can come to the hospital or the clinic or their doctor's office, and know that they're safe and that we care about them, and that we will, continue to do what we think is best according to their health needs. So, Chatty Doctors was interesting. It was a very short case study. Basically, doctors coming in, talking about himself, leaving the room, and the patients left there like, what just happened to me? And we really need to strive not to do that with our patients. I work with a lot of great physicians, and I've worked with a lot of different ones throughout my career, and honestly I can say I really haven't had a doctor that's been so chatty that he has lost sight of what he needs to do for a patient. I do know that there are doctors that do that, and me as a nurse, I tend to go into the room with the doctor if I can, when he does the initial evaluation, and then when he goes back to do the results for that patient. So in the event there tends to be a change of conversation that's not addressing the patient's needs, I can kind of step in and redirect that conversation so that everybody's on the same page, that the patient is feeling that she's being heard by the physician or the doctor, and that we all are doing what is necessary with the patient in mind. So that is the case study for Chatty Doctors, and thank you for listening.